All right, well, thanks everybody for joining us on today's Lake Region Town Hall Forums. I'm Kent Matson, your Chief Executive Officer, and I'm going to be joined today by a panel of people who are going to share some conversations about what's going on and some things to remind you of. I'm not going to go through the agenda here, but just put this to your review as you review the slides and perhaps the video recording as this becomes available later on. One of the things I did want to remind people is as you're listening in, please feel free to raise your hand using that functionality on Teams here, or type a question into chat at any time. We've got a couple of people that are monitoring the chat to make sure that we can get your questions answered. One of the things we want to let you know is we very much appreciate that anytime we share a survey opportunity for you, we appreciate those of you that respond. We did a recent communication survey and over 310 people responded to that. And that is acting as a catalyst for change in many areas. A couple of things that I want to share with you today is two big things regarding communication. Those of you that have joined us recently and have gone through orientation sessions, I always share we really thrive on communication, both sharing with you and hearing from you. So we're going to continue to do the town halls. We overwhelmingly heard from you that we should keep these up as ways to communicate. So we're going to do those 3 or probably 4 times a year. We're going to shorten the time of them a little bit more to make sure that we can create impact and respect the time that you take between work. And we're going to finish a little bit earlier to give you time to get back to your work as we give you a little bit of time to get here by not starting at noon. We're also going to increase access. We heard from folks that it's not always easy to access the central line. So the team's got some ways to improve that through captive ways to share the video recording. In terms of the items of note, or the INs as we call them, we're going to keep doing that. We heard overwhelmingly that you all appreciate that. So we're going to keep up the frequency once a week. We're going to keep the content aiming at what we have. And we're going to try to keep it brief for quick review. So we appreciate, again, you sharing your communications preferences, and we hope to support you by changing the way we do things. One of the things we always want to do is recognize the great work you all do. Most recently, we heard from Chartis, which is an organization that takes a lot of data points and makes recognitions in the rural space. And the really unique thing this year for us is both of our hospitals, one in Fergus Falls and one in Elbow Lake, were recognized by Chartis as being in the top 100. So if we think about there being over 4,000 hospitals across the United States, being in the top 100 for critical access organizations as well as rural and community organizations is pretty significant. And that's all due to the great work that you do hour over hour, day over day, week over week, year after year. So thank you for the work that allows this recognition to be made. Want to give you some updates on what's going on with our New Waters strategic plan. We recently entered into the second year of our multi-year, multifaceted strategic plan that was driven by our desire to remain independent. So some high-level updates for you all. One of the things that I think you would recognize is this slide shows us the desired end state in our strategic guideposts. These are the high-level pieces that guide our strategic plan and guide our execution framework, because what we're trying to do is retain that identity as a community-based organization. One of the things that's important to this is to execute on our New Waters strategic plan, and we want to continue with growth, deliberate growth, smart growth. That means expanding service offerings, serving communities with more services as we can, and then focusing on access, because we never want to turn a patient away because we don't have capacity. One of the things, though, that's a little bit different about this slide at the top is you're going to hear me start talking about a regionally governed healthcare enterprise. Some of the other day said, well, does that mean we're going to start being taken over by a system? And I said, no, what it represents is we are a regional organization already. So the next slide kind of gives you a picture of what I mean. So if you take a look at this strategic regional footprint, this shows the very large service area that we have the privilege to serve. And if you see the insert there in about the middle of this slide, you can see that our service territory comprises approximately 5,000 square miles of the state of Minnesota. Visually, that's a pretty good chunk there. Overall, Minnesota has about 86,000 square miles of space. Much of that is water because we're the land of 10,000 lakes. But if you think about 5,000 square miles out of 86,000 square miles, we have the privilege and the imperative to serve a pretty large swath. So when I say regional, that's what I mean. We're a regional organization covering a large territory, and we have to just recognize that because we're no longer just about Fergus Falls or just about Elbow Lake. We're about more. I won't dwell on this slide too much, but this will be posted along with the video recording of this session. But this just is a reminder of why we are engaging in the important work under the New Waters Strategic Plan. It's hard work, but it's good work, and this is what we want to aim at. And again, first and foremost, it's all about our people and our communities. Some key milestones that I wanted to recognize. Lots of great work was done by the teams in 2025 after we launched this initiative in February. So we took our two healthcare organizations, merged them into one. That allows us to be today a single nonprofit tax-exempt corporation. We also cleared a bunch of regulatory hurdles to combine our two hospitals into one license. So we have a single company with a multi-campus regional care delivery model. And again, there's that term regional. And then taking these two important structural changes, we leveraged some opportunity to work within the federal government requirements to expand critical access eligibility as of October 1st of 2025. We just happened to go live with that new structure on the federal shutdown, but eventually on December 9th, we got validation from the federal government through a tie-in notice that confirmed our availability to work into the future with that critical access reimbursement expansion. So we also brought many of our operations together as of October, and we really formally concluded our prior separated two-company model when we completed an audit in February of 2026 this year after our boards approved on January 2028 the final audit. So it really closes out our chapter of Prairie Ridge Healthcare and Lake Region Healthcare being separate. So moving forward, we are one company fully unified on operations. And then most recently, we did get a renewal of our Minnesota Department of Health multiple campus single license. And so we'll be moving forward with that structure into the future as well. Just really good work, and thank everybody for that progress. Next slide gives us kind of a picture of our work streams in 2026. I will leave this to you for your reading, but this just is the way for us to organize and project manage all of the work that has to go into achieving what we're trying to work through in our second year of our New Waters Strategic Plan. We're using external resources, we're using internal techniques as well to manage all of that outcome. And this is just kind of a breakout of some of the key actions and activity in 2026. So Operation Fortify, which is our performance improvement structure that has been part of our operations. We're going to continue on with that. It's going to be part of our operating DNA into the future, finding ways to grow, finding ways to cut some expenses on top of continuous improvement on our budget. We're also going to make sure that we are leveraging that unique single company multi-campus regional operating model to expand 340B eligibility to most all of our operations. And we're targeting that for just a few weeks out here. So like we expanded critical access reimbursement to all of our sites, we're really focusing on bringing 340B expansion as well. So lots of good work happening there, and we look forward to reporting success at our next town hall. There's a team also working to convert Barnesville to a rural health clinic, which is a key to achieving our eligibility for 340B expansion and critical access. Also, some really important work, and we're excited about this tomorrow. We're going to have a visioning session with some of the leaders tomorrow. We want to make sure we can articulate to you all our long-term strategy and our execution plan to have market-based benefits and pay for our entire workforce, while continuing to roll out this year some improvements, such as better 401k contributions. So we hope to share more with you at our next town hall about what that looks like to really capture the vision and where we're going to make sure you're paid well and your benefits are market competitive. In the meantime, though, while we're working on a renovation plan for the Fergus Falls campus, we're working on a solution to bring robotics, that is a surgical robot, the Da Vinci, to our organization. And to do that, we've got to enhance our sterile processing. So while we wait to start our building, we want to make sure that we can roll out a robotics plan sometime in 2026 so we can give our surgeons that state-of-the-art tool, and we can give our community what's becoming standard of care, which is surgical robotics. This year, we kind of are revising our aim. We had hoped to start some construction in 2026 for some of our facilities, but we're really working hard with USDA, which is our prime lending source to do a community's facility. So throughout 2026, we're going to work and come up with an actionable multi-year facilities, utilities, equipment, and technology renovation plan for our Fergus Falls Hospital campus, and bring to our Finance Committee and Board for review and approval a feasible financial budget and a comprehensive funding strategy so we know what we can pay for over what period of time, but more to follow on that. But again, in the meantime, we want to make sure we get our robotics program moving forward. So again, people keep asking, why are we doing this? And this next picture is kind of worth 1,000 words. This is something that we shared with you. It's all about strength and growth. At the center is that logo that we started in 2021, making sure that we're aiming at our people, surrounded by our values. But we want to make sure we can invest in updated facilities, leading technologies, market benefits, and pay for everybody in our workforce. And all of that will yield healthier communities. So thanks for listening to the updates on our New Water Strategic Plan. Now we're going to take a dive into some more of the things that others are going to share with what's going on at Lake Region. So I'll first hand it over to, I think, Angie Crummy. Actually, Chris Johnson's going to lead off with our finance pillar. So Chris, you're ready to take the mic?
I am. Thanks, Kent. All right. Good afternoon, everyone. Chris Johnson. I'm a Chief Financial Officer here at Lake Region. Just wanted to share quickly update on our finances, and it really leads nicely and right after the update that Kent just gave. So I'm happy to report that for through the first 4 months of this fiscal year, our fiscal year once again starts on October 1st. 3 of the 4 months of the year so far, we have reported positive operating margin results, and we beat budget 3 of 4 those months as well. So through January, February data is being compiled right now by the finance team. Will be done in the next week or so. But through January, we have a positive operating margin of 1.4% on a year-to-date basis. That is beating our budget. Our budget on a year-to-date basis was expected to be a positive 0.4%. So we're beating budget by about a full percentage on operating margin. And when we compare to where we were at the same point last year, we were at a negative 1.4% operating margin. So almost a $2 million positive operating margin swing year over year. And that is due to the new reimbursement structure that Kent just talked about. The critical access reimbursement is proving out and allowing us to operate in more positive territory than we have in the past. We're doing that through really good expense controls as well. Our expenses through those first 4 months are very near budget, actually under budget in nearly all categories. Drug expenses have been over due to some additional high volumes there, and then some of the utilization of high cost drugs. And on the revenue side of things, we've seen volumes be lower. So we're keeping a close eye on volumes. We're significantly under volumes on our inpatient volumes, about 20% under what we saw last year. So we're doing a lot of digging into what's exactly driving that. So overall revenues just slightly under, but that new reimbursement is proving out to be even a little bit better than we had planned. So overall, bringing in operating margins very, very strong and stronger than what we had anticipated. And just a reminder, by the end of the year, we're anticipating and have budgeted a positive 3.1% operating margin. I know I've thrown out a lot of numbers there, but what that means is exactly what Kent led to is our operations are performing and producing margins that will allow us to invest into all of the things that we need to do. Facilities, equipment, people, and really our community. So good report card for our finances through the first 4 months of the year. And I will turn it over to the next speaker.
I think I'm taking this one. So Sarah Fulton, Director of Clinics. In 2025, we welcomed 12 new providers into our organization. Those additions strengthened several of our specialty service lines, including cardiology, psychiatry, surgery, podiatry, and primary care. And then as we move into 2026, we continue to expand our services to better meet the needs of our community. So upcoming additions include Dr. Moncrief in urology, Don Dahlgren-Romich, who's a certified nurse midwife, Dr. Kemp in radiology, Dr. Ham in sports medicine, and Miles Wasik, who will be joining the Barnesville Clinic. We also recently announced the conversion of the Bridgeway unit into a new space for women's and family health. And that move helps move that team closer to the inpatient and OR departments, and it also opens clinic space for future clinic growth. We spent a lot of time last year to standardize annual wellness visits, well child checks, and many other quality opportunities within clinical care. Our focus continues to ensure we're readily available for our community, promoting both our specialty and primary care services, supporting visits that maintain high quality care, which also ensure financial sustainability for the organization. Many of the things that we're working on drive both visits and work reviews while ensuring we're providing preventative care and ensuring our patients remain healthy. I'm not sure, I'm handing it over to somebody. Oh, and there's the slide of the providers. I think Molly's going to take it. Yeah.
Hi, everyone. I'm Molly Reagan, the Executive Vice President of Clinical Operations, and I will be reviewing our growth around our surgical procedures. Beginning in October, we started capturing all procedure minutes requiring anesthesia and improved performance as our newer surgeons got ramped up and OR turnover improved. And since November, strong coordination across OR leadership, surgeons, and our clinic teams have driven consistent gains with volumes exceeding goals month over month. And year to date, we're at 2% above goal, reflecting that improved scheduling and OR efficiency.
Good afternoon, everyone. I'm Ann Heidemann with the HR team. Before I, before I get into my update on the people pillar, I wanted to just step back for a moment and make sure we all have a solid understanding of what we mean by employee engagement and what we're measuring each June. Employee engagement actually isn't about happiness, and it's not about job satisfaction. Rather, what we're actually measuring is our willingness as employees to give our very best effort at work because we believe in our mission and because we feel valued. We measure our engagement indicator score on a 5-point scale with the help of Press Ganey. Our goal this year is to continue our positive growth by improving from a 3.87 to a 3.91, which would be a statistically significant increase. And for our providers, our goal is to increase to a score of 3.85. If we meet our goal, this improvement helps us move towards our longer-term overall goal of being positioned in the upper 50% of all healthcare providers across the nation. Next slide. Earlier this winter, some of you were asked to take a short pulse survey as a means of checking in with some of our teams. I just want to thank you, those of you who completed that survey. The results have been shared with the leaders of those 16 teams. And really, anytime you're willing to share feedback, it's really meaningful and truly appreciated. We'll all have the opportunity again this June to complete the full survey. The feedback you share with us together helps us build the right conditions for each of us to give our best at work. I want to take a moment to remind you of some of the things that you shared with us last June and what we've been working on based on that information. These are the things that Lake Region is giving extra effort to in addition to all the various focus areas that your teams are working on. So you told us that you wanted to see improvement in the survey statement. This organization provides career development opportunities and the person I report to cares about my job satisfaction. Next slide. Then we asked you to partner with us and help us understand what meaningful career development opportunities means to you. And we also asked you to share what type of recognition is meaningful to you. So thank you again for those who have shared with us. Your leaders, including myself, have really appreciated hearing from you. And I thought it might be nice to hear a few examples of what's been implemented regarding career development. So at the Cancer Center, they've supported training and attendance related to oncology operations, billing, and patient care support. They've also provided some cross-training opportunities to expand knowledge on their team. The facilities team is continuing their boiler engineering program. Our finance team participated in a webinar series about critical access hospitals. And they also added team members to some of the Operation Fortify work groups. And we did that with our HR payroll team members too. Several of our radiology team members became CT certified, and members have become cross-trained in modalities that are of interest to them. Our education team is a great resource for many opportunities that are available across our organization. I've heard about book studies and EPIC training and opportunities to complete certification requirements, just to name a few things. So you shared with us a couple of other areas that we're giving extra effort and focus on, and that is continuing our work on safety to prevent errors and keep teammates and patients safe. And you'll hear more about our Good Catch efforts shortly. And lastly, we are giving important effort to the statement about respectful communication across the organization and soliciting your feedback about work that directly impacts you. So this is a perfect segue into some important updates that Molly's going to share about high reliability. So back to you, Molly.
Thanks, Ann. So high reliability organizations operate really safely and in complex environments. And really, HRO is not a program or initiative. It's really how we work every day. At the core of high reliability is communication. So open, structured communication helps teams anticipate risk, speak up about concerns, learn from events that occur. And when we do this well, it improves patient safety and reliability for our teams. And many of these behaviors are already part of how we operate today. Next slide. So high reliability is already embedded in a lot of things that we do today. I'm not going to read through all of these, but I think you might be surprised how they all relate back to HRO. Safety event reporting, the Good Catch reporting that we do, the daily safety huddles, the safety briefs that we have, and really also reinforcing this through town halls like today, our engagement surveys, the pillar goals that we have, and leadership rounding. So this work spans throughout clinical areas and non-clinical area teams across the enterprise. So the next step in strengthening how we connect these efforts through communication is through engagement. The communication surveys, we heard several themes. And so what we're working on is, hearing that you want more local communication, consistency and timeliness, closed loop follow-up, leader presence and accessibility. These insights from the survey are helping us guide how we strengthen our communication across the organization. And so one important way that we're addressing this is through daily huddles. Daily huddles help teams. Tiered huddles help reduce surprises throughout the day because teams are sharing information early. They also allow us to identify issues sooner and escalate concerns quickly. They help us improve communication, team morale, because everyone understands what's happening. Huddles align teams around our organizational priorities and strengthen leader and team relationships. And most importantly, they help us close the loop, the communication loop so that information can move up and back down throughout the organization. And to make this work throughout the organization, we connect these through tiered huddles. So tiered huddles are not any more meetings, they're a communication system. They ensure that priorities and expectations flow down, risk and barriers flow back up, communication stays closed loop at every level, And this helps leaders, respond faster, remove barriers for you, and support teams in real time. So really high reliability depends on communication. Tiered huddles help ensure the right information reaches the right people at the right time so we can deliver safe, reliable care. I'll jump right into our good catches as part of our high reliability organization. So our goal for this year is 250, and so far we're on track. A little bit of a slow start in one of the months, October, but we're gaining traction. Just please remember to enter any of your good catches into the system because they all matter. Next slide. I would like to highlight Allison Rosenkrantz receiving the January Good Catch Award. Allison identified open Epic encounters and partnered with our IT to uncover workforce gaps across the clinical and operational teams, and ended up redesigning the process to improve workflow and operational efficiency. But I'd also like to highlight Becky and Nadine. So Becky identified duplicate procedures scheduled at the same time, requiring the same equipment. And Nadine noticed lab results in the locums provider's Epic in basket without follow-up. So just as an example, these highlight how proactive problem identification and teamwork strengthen patient safety, improve our workflows, and support a reliable care across this organization.
Hi, Nikki Ness, Patient Experience Specialist, going to talk about our service pillar a little bit. So the service pillar is our patient experience goal. What this is it's the measurement of the likelihood to recommend question that comes from all of the different service surveys that we use for our different service lines. We have 24 different departments, and as of last month, we had 14 of those departments meeting goal. So we're below where we'd like to be, a little drop over the last few months, but we have 20 departments that are either meeting goal or are kind of trending upwards. So we're sitting pretty good for this fiscal year so far. Leaders get detailed reports about their own patient experience in their areas. They use that for action planning and to help figure out, what do we need to focus on for patient experience opportunities in our areas. If you want to know what your area is working on and focusing on for patient experience, just reach out to your leader. From an enterprise level, and you can switch slides, Seth. From an enterprise level, we're looking at across the board, what can we do to have an impact on our patients and our teams? So we're looking at kind of the broader topics of, things that impact people across departments and not just department specific goals. We've also revamped that group. We've added some non-nursing patient care areas because we want to have a broader perspective of how we're impacting our patients. Although we do measure patient experience for specific departments that are surveyed, we know that patient experience is really owned by everybody in the organization. We all have the opportunity to interact with patients on a daily basis, whether in our department or when we're walking in the halls, and we certainly interact with each other on a daily basis, so we're impacting those internal customers. It's the things that we do and the way that we work, how we carry ourselves, how we interact with each other, the smiles that we give to people in the hallway, the greetings that we share, holding the door for a person or picking up a piece of trash in the hallway. All of those little things all build up to, make or break that patient experience. So we all have an impact. And certainly when we're collaborating with each other and supporting each other, we're all working towards that goal of being the best place to give and receive care. So much of healthcare today is consumer-based. So it really is important that we're trying to make that impact with every patient every time, because patients have a choice where they go for healthcare, and we want them to choose Lake Region Healthcare.
Good afternoon, everyone. I'm Joanna Chua, Community Health Initiatives Coordinator and today I'm here to give you an overview of our Community Health Improvement Plan, or CHIP for short. For those who are not aware or may not be familiar, all nonprofit or tax-exempt hospitals are required to conduct a Community Health Needs Assessment, or CHNA, every 3 years. And based off of that assessment, we are required to develop a CHIP that outlines how we plan on addressing those needs identified in the assessment. Beginning this year, the state also added an additional requirement to strengthen oversight and ensure that tax-exempt hospitals are actually contributing and investing in the health of their communities. So we now have to submit additional reporting to the Commissioner of Health. But beyond those regulatory requirements, I think why it's most important for us to do this process is because it aligns with our mission and vision of having a healthy and thriving community. Additionally, it aligns with several of our values, in particular collaboration, stewardship, and innovation. Throughout this whole process, we collaborate with both internal and state and external partners to identify gaps in our community and explore ways on how we can work together to make an impact. Stewardship, unfortunately, we don't have unlimited resources to be able to address all of our health issues. So we need to focus on those wherein community need and our capacity to make an impact overlap the most. And innovation, in all of those, we identify evidence-based and evidence-informed strategies or interventions that we're already doing or we're planning on doing. So next slide, please, Liz. For our prioritization, we did use 2 criteria, seriousness of the issue, as well as our ability to impact. Based off of those, we came up with 7 health issues that rose to the top. However, as we moved on into the CHIP process, we realized that several of these health issues do overlap, and some of them have same strategies that address multiple health issues. So we decided that it's better to group some of these health issues. So instead of 7 health issues, we now are down to 4 priority health issues. So chronic disease, cancer, lifestyle medicine, and healthy aging have been grouped into a broader category of healthy living, while mental health and behavioral health, social determinants of health, and coordination of resources remain separate. So those are the priorities that we're going to be focusing on over the next 3 years.
Thanks, thanks, Joanna. Appreciate you sharing that information. For those of you that aren't familiar with the community assessment and action plan that we do, it's really important that as a community-based organization that we aim at those things which our community provides us feedback they'd like us to do. That's kind of the nature of our business. So we appreciate the great work by the teams that put that together. Any questions that have come up throughout the conversation here?
We don't have anything in chat at the moment.
Okay, just a few comments here before we hand it over to Kate Bjorge to share some information about the foundation. Again, not all of the content that's on these slides was shared, so we're encouraging you to review those slides. Also, if you could ask your peers that weren't able to join us today to review the recording of this and check the slides out. I truly believe that if we are all in the know and if we're all engaging and we're all providing feedback, multi-directional, that we're going to be better together. You heard quite a bit today about the improvement work that we're doing, from huddles to leaning more into HRO to doing town halls differently. And we really want to make sure that we're focusing on you. Nikki mentioned it. We really want to be the best place for our patients to receive care. And we genuinely, as a leadership team, believe that the best way to do that is if you have a workplace and the place that's the best to work and to deliver that care. And we're going to focus again on engagement with a survey of you all in June, but please lean into an understanding what engagement means so we can serve you better. Also, thanks to Molly. If you've been reading some of the IONS and other work or other communications that we shared, Molly has joined us in a permanent leadership role, so we're looking forward to working with her as we continue to work through New Water Strategic Plan, as well as working through where inpatient care and all the important ancillary areas that she leads go as well. So we're happy to have Molly join the team. Last call for any questions. Okay, I will hand it over to Kate with the foundation to share a little bit more. Thanks everybody for joining. We really appreciate it.
Thanks, Kent. Hi, everyone. Kate Bjorge with the Lake Region Healthcare Foundation. And first, just want to say thank you to so many of you who choose to support the foundation through your payroll giving, through one-time gifts at year end, through volunteering and through a variety of campaigns that we host in a given year. So we wanted to show you in the next slide just some opportunities that are coming up for you to connect with the foundation in our community. It really is a great way for us to connect with our mission, both externally and internally. So some really great events coming up, starting with this weekend. Community organizations and people are excited about Lake Region and often host events where we benefit. And that's the case this weekend with the chili cook-off at Outstate Brewing. We have our annual foundation gala, and as Kent mentioned, we will be aiming our funds at a great project, and that's the Da Vinci robot. So bringing enhancements to our surgical services, which is already an excellent program here at Lake Region. And the Lake Region Run, which certainly benefits our cancer center. Great opportunities for you to volunteer, register to run. It all benefits Lake Region. Something new is a showing of the Bee movie. That's in partnership with a Center for the Arts, and a great opportunity to connect, especially the kids within the enterprise and our region, with Buzzwell, our mascot, our guardian of good health. And then certainly the Lake Region Golf Classic, which is another fundraising event happening this summer. And so speaking of Buzzwell, I dropped a link in the chat. So if anyone is interested, we invite you to fill out a very short form. We are building a team of mascots. So we would love to have you join our team, complete that interest form, review the character summary so you know what the rules are for Buzzwell and how Buzzwell engages with people inside and outside of our community, and join us in helping spread joy through our mascot, Buzzwell. So that's it. That's the foundation update. We'd love to hear from you. And again, thank you for being part of a culture of generosity here at Lake Region Healthcare.
Thanks, Kate. And again, appreciate everybody joining, and have a great rest of your day and week, everybody.